Great. Good morning, everyone. Welcome to the medicine team. I'm looking forward to working with you over the next couple of weeks. My name is Ryan Nall. I'm a general internist. Before we get started this morning, I'd like to take the next 10 or 15 minutes and think a little bit about the goals we have for this healthcare team, as well as set some expectations for each other over the next 2 weeks. So to get started, I'd like everyone to introduce themselves, kind of report what stage of training you're in, and if you have any learning goals that you'd like to achieve over the next 2 weeks together. To get us started, Akeem.
I'm Akeem Bartley. I'm a third-year medical student, and for me, a tangible goal for me would be to better learn to characterize heart and lung sounds over the next 2 weeks.
Great. Excellent.
I'm Nick Kaufman. I'm a third-year medical student, and the goal for me over this rotation or clerkship would be to better understand pain management and how to address that concern that's pretty common among patients.
Sure. Great.
I'm Samantha DiBenedetto. I'm a third-year medicine resident. I'm actually the resident on the team for this rotation. And I still feel like cardiology can sometimes be a little bit of a weakness for me. So I'd really like to get a better idea, more comfort with managing cardiac cases, arrhythmias, atrial fibrillation, decompensated heart failure.
Great. Excellent. We can work on that.
My name is Nida Wahid. You can say Nida if it's easier. I am a PGY1, so I'm an intern. I think one thing that I just want to get stronger in is actually kidney disease and managing electrolytes, and as well as hyponatremia. I think that algorithm is always a handful.
Absolutely. I think we have plenty of opportunity for hyponatremia and a lot of these goals. I think those are great. Something I do, and I'd like to pass out a index card here and just put your name on one side and your goal for your learning goal on the other. That way I can kind of keep tabs of those over the course of our time working together. And so while you're doing that, we'll move on to the next thing I'd like to discuss this morning, which is really our goals as a healthcare team. And I want us to kind of think about those together. So at the end of these 2 weeks, really what goals do we want to achieve as a healthcare team? Any ideas?
I think, well, generally speaking, we're obviously dedicated to the well-being and health of our patients, and I think a great way to kind of achieve that goal moving forward is to better focus on like the patient and their family, their goals, their concerns, and to involve them in the decision-making process to make them feel like they're part of our team as well.
I love that. That's great. Thanks, Nick.
I mean, I think always patient care is very important, but also providing good care in a timely fashion. And so making sure that we have very efficient rounds so that we're also able to take good care of our patients and be ready for some of the new admissions coming in.
That's great. Excellent. And one personal goal I always have is being an outpatient doctor as well, is to work on safe discharge plans and to try to prevent hospital readmissions as best we can. So another item I want to discuss is the roles of each of you on the team. I think it's really important for us all to understand kind of how we work together and what that role looks like. And without really defining those expectations, it can be difficult. So I've written out some expectations I have for each of the roles, and I'd like to take a few minutes here for you all to look through these and see if does this align with what your thoughts around the roles really are, or is there anything that's different than what you'd be expecting? Take a couple minutes there. Good. Next up, I'd really like to review some expectations for oral presentations. What I found in my time working on the medical wards is that one way to maintain kind of the pace on rounds and to make sure we see all our patients in a timely fashion is to maintain kind of succinct, focused oral presentations. So I want to encourage all of you to use the SOAP format for those presentations, and you really want to have that presentation in 2 to 3 minutes. So of course, some patients may last a little longer, but in general, most of our patients we can present in 2 to 3 minutes. And the focus should be on interval updates since the last time we met with the patient. And I've got a great video that we can review here to give you an idea of how to do those oral presentations.
All right, so as you know, Mr. Jones is our 59-year-old protein chemist who has chronic obstructive lung disease and who was admitted to the hospital for pneumonia. Subjectively, he has felt better over the last 24 hours. His sputum production has decreased, and now he only has scant white sputum production. Objectively, his temperature is 37.2, pulse is 70, respiratory rate of 16, blood pressure 130/80. On his physical exam today, his lung examination only reveals scattered RALs in the left lower lung field, and his E to A changes have now resolved. His white blood cell count has decreased from 14,000 with 90% PMNs to 9,000 with 70% PMNs. His chest x-ray 2 days ago demonstrated a stable left lower lobe infiltrate, and his sputum gram stain revealed gram-positive lancet-shaped diplococci. However, his culture only grew normal throat flora. His urine antigen, though, was positive for strep pneumonia. So for my assessment, Mr. Jones's pneumococcal pneumonia is steadily improving. And my plan, we can discontinue his IV ceftriaxone and continue him on his oral azithromycin alone. And in terms of disposition, if he continues to improve, I think that he could be discharged to home tomorrow.
So next up, what I'd like to discuss are kind of some milestones, ways that we can figure out whether or not we're achieving our goals that we set out. So initially, Nick, you talked about great patient care and involving the patient and their families in decision making. Any ideas on any milestones that we could use to see how we're doing with that?
Well, yeah, I mean, we definitely want to quantify how we could do, how we're improving involving the patient and their family.
Mm-hmm.
I think something like a simple survey, even just giving out to patients and the family members to kind of quantify on a scale from like 1 to 10, for example, how involved they felt with their care, how much communication they have with their doctors
Sure.
and the team members, something like that. I think would be a good way to measure that.
Yeah, I think even looking at how often we're meeting the patients and their families at the bedside,
Yeah.
you know, and having those bedside rounds is a good marker for that as well. Good. Other ideas on milestones?
Well, I would just kind of say, piggybacking off of that, we should really make it our best effort to introduce ourselves in each of our roles to the patients and their families, because it can get confusing when there's a large team and we also have consultants. So that I think that can clarify some of the misconceptions they have to know who they're speaking to and what the role is in their care.
Great. Absolutely. These are all great. I think the other thing we can watch out for is in how we're making decisions. Are we, are there arguments on the team? Is there any anger or frustration on the team? And really reassess this learning environment. I think, a weekend, make sure we're achieving a good environment for everybody on the team. And finally, I'd really like to focus on what the behavioral norms or kind of the norms are for our group and our team. And the way I like to think of this is, what are some things we should never do, and what are some things that we should always do? So let's start with things we should never do as a team. Any ideas?
Never be disrespectful.
Yeah.
All right, that's like the major one. Always coming across as professional, even whatever setting that might be.
Sure.
And whether that's with patients, their families, colleagues, etc.
Absolutely. Yeah, I think that's a great summary in terms of being respectful to others. What are some things that you all think we should always do as a team?
I think always treating everyone on the team as like equals. It can be easy to say, oh, well, you're just a nurse or you're just whatever, So I think, keeping it in mind that, we all as a team are working to provide like dynamic healthcare, and, each one of us are in like a level playing field in a sense. I think that goes a far way in terms of like keeping like respect and, keeping respect and keeping the team dynamic flowing efficiently.
Absolutely. That's great. Yeah, and I think regardless of anybody's background or level of training, I think making sure there is a safe place that someone psychologically can feel healthy to learn and take care of patients. And I think that's where we're going to do our best work, really. Finally, I wanted to just briefly talk about how do we make decisions as a team and kind of what the process should look like for that. Sam, what do you think?
Well, I know you said this is a safe space, and so I think that we really should encourage everybody to kind of contribute in each patient's care, hear everyone's input or opinions or ideas on how we can manage a patient together.
Yeah, absolutely. I think, we'll absolutely look for consensus amongst all of us and everyone's idea together. If there's disagreement, as the attending, I'll pull the card as the person that gets to make that final decision. Hopefully we can always maintain some consensus amongst us with that. And finally, I think, just in our wrap up before we head off to rounds, I really believe that if we really focus on communication, like we started here today, and focus on working as a team, we can provide great patient care. And that's really my primary goal for all of us on this team, is to provide the kind of care we'd want for any of our family members if they were to be hospitalized. So I think in doing that, we're going to have a great time, and we're going to learn a whole lot over the course of the next 2 weeks. So I look forward to working with each of you.
Thank you,
Thanks.
Dr.
Thank
Thank you, Dr. Nall.